Hello everyone, welcome back to my channel. In today's video, I'll be talking about chronic inflammation. Chronic inflammation is of a long duration, lasting for weeks, months, or even years. Let's talk about the characteristics of chronic inflammation. Chronic inflammation is characterized by 1. Infiltration of mononuclear cells, 2. Tissue destruction and repair, 3. Proliferation of new vessels, and 4. Fibrosis. Infiltration of mononuclear cells, that there is increase in the number of mononuclear cells. I'll throw more light on this when I will talk about the cells of chronic inflammation. Tissue destruction and repair. The process of chronic inflammation destroys the tissues, and this is followed by tissue repair. Proliferation of new vessels. In the site of chronic inflammation, there is a rapid increase in the number of new blood vessels. And the last one is fibrosis. There is increase in the number of fibrous connective tissues in the area site of chronic inflammation. And all these are in contrast to acute inflammation, which is of short duration and is characterized by vascular changes, that's changes in the blood vessels, that's within the blood vessels, edema, that is excessive accumulation of fluid in any part of the body, and neutrophil infiltration. Neutrophils are cells of acute inflammation, so there is presence of sufficient amount of neutrophils in acute inflammation. Having said this, acute inflammation can end up either in 1. Complete resolution with restoration of the tissue to its normal state, or healing by scarring. That's scar tissue formation, leaves a mark, a scar on the tissue, usually on the skin, or abscess formation, that's in case of suppurative inflammation, or progress to chronic inflammation. And so, chronic inflammation can be as a result of it progressing from acute inflammation, or the response was chronic from the onset. So chronic inflammation can progress from acute inflammation. That there was acute inflammation initially, then at some point acute inflammation stopped and chronic inflammation took over, or the response from the onset was chronic inflammation. Now let's talk about the etiology of chronic inflammation. Chronic inflammation is usually caused by irritants of low intensity. That is, these irritants, they fail to stimulate the body defenses to destroy or cause the removal of these irritants. When they enter inside the body, they don't do anything. Like, the body defenses, the immune system of the animal does not even notice the irritants. They just lie there, and the body defenses are not stimulated. These irritants are not destroyed or removed. They are just there. They don't stimulate anything. They are very low intensity. And so, persistent or prolonged exposure to such irritants will result in chronic inflammation. Example of such irritants are bacteria such as the Mycobacterium tuberculosis. Resistant infection with this bacteria, that's the Mycobacterium tuberculosis, which is an intracellular microorganism, will result in chronic inflammation. Another example is phytotoxins of certain plants. Another example is foreign objects or foreign materials such as sharp objects which enter into the body of the animal, dust, insisted larva of a parasite, inert materials. All this prolonged exposure to some of these inert materials, such as asbestos, can result to or will result to chronic inflammation. Another cause of chronic inflammation is constant or repeated trauma to wound, which delays the healing of that wound. It also results to chronic inflammation. This is a case of acute inflammation progressing to chronic inflammation, as the wound is constantly traumatized repeatedly. From from there, it will result to chronic inflammation. And that's it for today's video, guys. Today's video is a very short one. In my next video, I'll be talking about the cells of chronic inflammation. Remember, I talked about the characteristics of chronic inflammation, and I said that chronic inflammation is of a long duration and is characterized by infiltration of mononuclear cells, tissue destruction and repair, proliferation of new vessels, and fibrosis. And all these are in contrast to acute inflammation, which is of a short duration and is characterized by vascular changes, edema, and neutrophil infiltration. Okay, that's it for today's video, guys. See you in my next video, and don't forget to hit that subscribe button, ring the bell icon so you'll be the first to get notified when I drop my next video. And also give this video a thumbs up if you enjoyed it, and drop a comment for me in the comment section. You can also ask me questions in the comment section, and I'll be glad to respond to all your questions. Thank you so much. Bye.